Hi, welcome to the Form and Fitness YouTube channel. We're here at our beautiful headquarters location. I'm Dr. Ben Quist.
And I'm fitness expert Jeremiah Kruger, and today we're talking about how to bulletproof your shoulders.
So Jeremiah, have you ever injured your shoulder weightlifting?
I actually have. It was probably about a year ago now. I was bench pressing and I hurt my right shoulder's biceps tendon.
I have also hurt my shoulder bench pressing back in my 20s. I had multiple cases of rotator cuff tendonitis. And right now, here in our clinics at Form and Fitness, it is one of the top 3 injuries that we see, being shoulder, lower back, and knee with weightlifting.
So Ben, why is the shoulder so vulnerable when we're exercising our upper body?
The reason, Jeremiah, is the anatomy of the shoulder joint. Ladies and gentlemen, this is one of the areas where I really think it's important for you to understand the anatomy of the shoulder joint so you buy into the things that Jeremiah and I are going to tell you so that you can bulletproof your shoulder. All right, Jeremiah, now for the anatomy. I'm really excited about this part. So let's start with the pec minor muscle. Pec minor is a bad actor in the shoulder. Pec minor attaches to ribs 2 through 4, then attaches back into the coracoid process of the shoulder blade. Action of the pec minor is to protract the shoulder. Then, of course, we go into the supraspinatus muscle. Supraspinatus muscle attaches in the supraspinatus fossa on the shoulder blade. Then that wraps around and it also activates instability
when you're moving your shoulder blade.
Jeremiah, are you sleeping?
What? No, God, that was great information.
Were you sleeping on a fat pillow?
Okay, we gotta make this less boring.
Okay, you're right. All right, Jeremiah, let me start over. So the shoulder joint has 2 main components. You have your upper arm bone or the humerus and your shoulder blade or the scapula. The shoulder joint has often been described as a golf ball on a golf tee. So the golf ball being this ball end to the humerus or upper arm bone and the teeny little cup that holds that ball in place on the shoulder blade or scapula. And what that creates is a lot of range of motion at your shoulder joint. But what has to happen then with all that range of motion is you have to have enormous amount of muscle control over that joint. And if you can't stabilize and control that arm bone on that shoulder blade, you are going to end up getting injured.
So your ability to stabilize and control your shoulder position, especially under load, is pretty important then.
Exactly, Jeremiah. It's super important. And if we deep dive a little bit further, we were just talking about that golf ball, which is the head of your upper arm bone, and that T, which is way down inside here, that little teeny T of that shoulder joint. This part on top, which is called your acromion process, which is just like a bony shelf on top of your shoulder, right underneath it is where the supraspinatus tendon lives. And if you are doing exercise with bad form and you're not holding proper shoulder blade position, that tendon ends up getting rubbed or pinched underneath that acromion process, and that's what causes the injuries that we see in clinic, like rotator cuff tendonitis and also rotator cuff tears.
So it's popular on social media for people to say that they've done exercises like bench press or behind the neck pull downs or presses for years and have never been hurt. How come some people can do this and not get hurt and some people get hurt super easily?
That is a really, really good point. Let's move over here. All right, so here we have a graph. Your acromion process is individual to you, and they've done this through looking at x-rays. Everybody has a different shaped acromion process, and that's why some people can get away with doing different lifts with bad form over time and never have a problem. But that group of people, as you're going to see, is a small percentage of the population. The majority of us can't. So 3% of the population have an acromion process that tips upward, which creates a lot of good space under there, so a lot less likely that things are going to get pinched. 12% of the population has an acromion process that just goes flat, similar to the model that I showed. Also, great acromion process to have, a lot of space underneath there so that rotator tendon has a lot of room to move. But unfortunately, the great majority of us, which I'm in this category, 56% have an acromion process that hooks downward, and 29% have an acromion process that really hooks downward like a bird's beak. So 56.
I did the math on my phone.
Is it 85?
Positive, because
Okay,
this is
all right.
15.
Okay, so okay, so bottom line with that, Jeremiah, is 85% of us have to be careful because we've got that hooked acromion process. And then there's the gifted 15% that don't have to worry about anything.
So Ben, if we're not that lucky 15%, how do we avoid injury when we're exercising?
So with exercises like bench press, lat raises, upright rows, it is critically important that you maintain a position that we like to call here shoulder blade neutral.
So what is shoulder blade neutral?
So before we get into shoulder blade neutral, we got to talk about what the shoulder blade does. So the shoulder blade has two different motion patterns that you consciously control. The first is elevation, which is pulling your shoulders up, and depression, which is pulling your shoulders down, protraction, which is pushing your shoulders apart, and retraction, which is pulling your shoulder blades together. The shoulder blade also upwardly rotates. That is not, it just happens naturally when you move your arm up. The shoulder blade will upwardly rotate when you do that, and the shoulder will downwardly rotate as you lower your arm. Okay, so the position you want to be in for shoulder blade neutral are your shoulder blades pulled together a little bit and down your back a little bit. And the reason for that, I'm going to show you on the model. Okay, so what happens when you are depressing your shoulder blades and retracting them? It is going to open up this space underneath that acromion process where that supraspinatus tendon lives, and it's going to give it more room to move. So let's take a look at what that looks like. So if I'm going to pull my shoulder blade down and I'm going to retract it, can you see how much room has been opened up underneath that acromion process for that supraspinatus tendon to live and be happy? Now, if Jeremiah protracts, he moves his shoulder blades apart and he elevates, can you see how it almost jams that acromion process directly into that supraspinatus tendon? So the typical faults that I see when people are weightlifting is they are adding a little bit of elevation into their shoulders and they're not maintaining retraction. And that's going to cause your chances of injuring that rotator cuff tendon to greatly increase. So here we have your average gym goer. Let's call him Mike. And Mike likes to bench press. Mike doesn't get into good shoulder blade posture. He's not maintaining shoulder blade neutral. He's elevated, he's protracted, he's slopping around with that bench press. I want you to picture a saw going over your rotator cuff tendon with each rep of the bench that Mike's doing. Now this is fine if it only happens once or twice, but Mike's been benching for years. Over the months and the years, suddenly that tendon gets inflamed, it gets irritated, it gets pinched, and then, snap, your rotator cuff ruptures, and you're not exercising for a long time. Okay, so obviously hurting your shoulder sucks, so we don't want you to do that. So we're going to show you the 3 different exercises that we see get injured the most for the shoulder joint. That would be your flat bench, your overhead barbell press, and your dumbbell lateral raise. And we're going to show you what they look like being done with improper form, and we're going to also show you what they look like when you're maintaining shoulder blade neutral. All right, so we're starting with the flat bench with a barbell. Now you already saw what this exercise looks like with sucky form. Now Jeremiah is going to show you the proper setup position. So first thing he's going to do is set his base. He's going to pull those shoulder blades down his back, and then he's going to pull those shoulder blades together. Boom. Now he has that nice solid base to complete the bench press. So fire away, Jeremiah. Do a couple good reps here. You can see that he's creating great space between his ears and his shoulders, and he's maintaining that shoulder blade position throughout the entire motion. We have Jeremiah doing the overhead barbell press. We're not even going to load him on this one because it is so dangerous if you're in bad form on this. So we're going to use a PVC pipe to replicate our barbell. So Jeremiah, let's start off with what bad form looks like. You can see that Jeremiah is over elevated at his left shoulder. He's protracted through those shoulder blades. When he's coming up, the bar isn't even over the top of his head. It's to the forward front position of his body, so you know that he's too protracted. This particular motion, you have to have enough range of motion at your lats and also in your pec minors to do this appropriately. In future videos, we'll show you how to assess whether your lats and pec minors are tight. Now on to the lateral raise. This is another one of the repeat offenders that I see causing injuries, bringing people into the clinic. And what is bad form? So you can see a lot of elevation occurring. You can see how his shoulders are getting closer to his ears as he's repping. You can see that there's definitely protraction happening through his shoulders as well, meaning those shoulders are positioning forward, okay? He's jutting his head forward. This looks awful. Now we're gonna reset. Jeremiah is gonna do this in perfect form now. So setting position, his shoulder blades are down. They're also back, maintaining his position through there. There's space between his ear and his shoulder. He is staying retracted through the whole motion, so he's looking real good. Nice work, Jeremiah.
So one final point on lateral raise. This is something that we talked about a long while back. When I was up and coming and learning how to work out, I was watching a lot of bodybuilding videos online, and I was taught to bias or focus on the rear delt. I would have to tilt my thumb forward or pinky upward and then raise up. And funny enough, that is a terrible thing to do, and here's why.
That is actually the test that we use in physical therapy to determine whether someone has an inflamed supraspinatus tendon. It's called the empty can test, and that's how we test for that injury type. So if you really want to hurt your rotator cuff tendon, make sure to internally rotate that shoulder and raise it up when you're doing those lateral raises. Okay, so in summary, I think we've kind of beat this horse to death. We want to make sure that you are maintaining shoulder blade neutral, which is the shoulders pulled together and down, with most of the different movement patterns that could potentially injure your shoulder.
So thank you guys for watching. Any interest you take in what we do is really awesome.
Also, click the link below if you're interested to find out about some of the free personal training programming that Jeremiah have online.
Thank you.